everyone. I will get started, and as we go through these things, just know that later there will be minutes posted. I've got some links I'm going to pass on to Shelley to add to the minutes, just things I'll display to make it easier for later. And then you can always raise your hand with questions as we go through. You don't have to wait to the end. If you're like me, you won't remember your question by the end if you do that. And then because Shelley said that we're treating these as public meetings just to be safe, there will be a recording posted later. If you, of course, the people on the call now won't need to listen to it, so I'll announce that again at the end if you miss parts of it. If you really want to listen to an hour of me talking, it's debatable. So I'm Ann Vosbrink. I am the EMS Data Administrator, EMS Data Manager for AZ-PIERS, which is the EMS Registry System. I would assume most people know that, but if not, I always want to mention who I am and what I do. And then if we have the people on for the next item, we'll start there. And if not, we'll skip forward and then come back. I don't know. Oh, yes, she's okay.
Yeah, I think Gabrielle's on.
Okay, great. Sure. Perfect. So some bureau updates. I just wanted to actually skip straight to Aubriana, who's going to talk a little bit about the request and action from EMS agencies to input your agency info into the National Pre-Hospital Pediatric Readiness Project. So, Aubriana, would you like to take over?
Yeah, thank you so much, Anne, for giving this opportunity. My name's Aubriana. I'm the EMS for Children Program Manager here with the Bureau of EMS and Trauma. I just want to bring everyone's awareness, all EMS agencies and fire departments that respond to 911 calls. This assessment is live for you, and it's going to be open until July 31st. We have about 14% of EMS and fire rescue agencies that have participated so far. Thank you, Shelley. This is actually the main page where you can go to access the assessment. And it's going to go over 7 different topics for quality improvement. So you have education and competencies, equipment and supplies, patients and medication safety, family-centered care, and quite a few more topics to review that a lot of your agencies are already doing. This will help EMS for Children learn to better serve you in the next 5 years. So as much participation as possible is greatly appreciated. I know Arizona is one of the leads for pediatrics, so just please take that assessment at your soonest convenience. Thank you so much.
Hey, Aubriana, do you happen to know, and if you mentioned it while I was writing down notes, I apologize, about how long does that assessment take?
Yeah. Thank you, Anne. I did not bring that up. So the assessment from the people that have taken it already, they've said that it takes anywhere from 20 to 30 minutes, the average time being around 25 minutes. So it's pretty quick to go through. You do get what's called a gap report after, which shows where your areas of improvement are and then also your areas of success. The feedback we've received from agencies is that this has been super helpful with them learning how they can better serve the PEDS community, and they're very interested in moving forward. So,
thank you, Aubriana. And if anybody has questions for Aubriana, please, you can put them in the chat, or I believe there's some contact information we can put in there. And the other thing I just wanted to mention is I love the fact that there's a feedback report that you get. That's so key, and it's not something we're always able to provide with the various surveys and links, and at least it gives you something useful back that you can then pass on to your leadership or whoever for education. So, okay, great. And Shelley put the link in the chat also, which makes it easier. And then Shelley, the contact us page. Okay. So this page is hopefully key. I know we get a lot of questions. I do not mind you emailing me and asking who you should ask about things, but we have this contact us page now, and not only does it have Rachel and Gail, who are your chief medical director, but it also lists many of you, if you have CONs, have been working with Karen Barnes about some questions about the HB 2609, and we'll go over that again later in the meeting a little bit. And then also for EMCT stuff, Maria Dominguez is listed on there. We have a new training person, Dan, and just additional context as you go down. So I think there we go. I'm at the bottom, but that is fine. They're all the people you usually email me about contacting are above me anyway, so that worked out perfectly. So yeah, I think this will be super helpful. To be honest, it's even helpful to me sometimes because I have to look in my emails to find contact information for some, even the internal people occasionally. So I think this will be really, really helpful. And it looks like it is, can you show them exactly? You go to contact us at the bottom. Okay. So yeah, you just go to our homepage and then the contact us. So it's very logical, which that's okay. All right.
I also wanted to add that on our homepage, bullhorn or call out box, we added a link to the annual ambulance revenue and cost report, CON compliance reporting, and HB 2609 summary report submission checklist. So I know it's kind of hard to find in our pages, so we added a link to the bullhorn.
And this we get a lot of requests for questions of, and this is that newer process. If you're not a CON holder, you may not have heard about it, and it isn't something that you have to be concerned with. If you are a CON holder, I hope you've heard about it. But this is a really nice checklist that someone in our bureau developed. I think it was Karen, and it is super helpful, hopefully, with walking through the different steps since it is a new process for all of us. And we'll talk about HB 2609 again a little bit later in the meeting, but I'm glad Shelley pointed this out because it is now posted in the, what is that called, bullhorn section?
Right.
So you don't have to go through a couple tabs to get to it, which I think will make it easier to access. Oh, CO2.
The not hidden area, but the alternate way is ambulance programs, ground ambulance program. And then you go down to the subheader of the 2609 resources here.
And there's a lot of other resources here that are super helpful too, that walk you through how to do different things. So it's still a really good section to know how to get to. So yeah. And I'll talk about this again, but since we brought this part up now, that those submissions for the HB 2609, which includes but the ARCRs for in most cases and the CON response time in most cases, and then definitely the HB 2609, that needs to be posted to the EMS portal, which is that, to the licensing management system by July 1st, which is Monday. Is that Monday?
It looks like. Yeah, Monday.
Yeah, Monday. So contact myself or Karen Barnes or Michael Grassi if you have any concerns or questions about that too, and we'll get it all sorted out. Okay. What is the next item? All right. So I don't know how many of you, we're going to talk a little bit about capturing populations that are less frequently analyzed. So illnesses, I mean, we call them illnesses, but impressions, if you will, or whatever's going on in the situation that maybe we don't look at as often. You guys, hear about it, ad nauseam, cardiac arrest and stroke and STEMI and trauma. And those are all really, really important time-sensitive illnesses. But we have a few other ones that we haven't maybe dug into as much in the past. And as we've done so, and that would be heat-related illnesses, and then also I'll talk a little bit about drownings. We've noticed that there is a potential gap in reporting the information in the areas that it needs to be in, and just some understanding on that. So I'm leaning on you all to make sure that your agencies, and I'll go through a couple, I'll kind of show you what I'm talking about, to make sure your agencies are collecting heat-related data and doing so in a manner that allows us to actually capture it. So I'm going to pull up a link. All right, so this is a national dashboard that's available publicly. It's on the
We
NEMSIS
don't see
website.
it quite yet.
Oh, you don't? Okay. Can you see it yet, Shelley?
No, ma'am.
Okay.
You want
So
to
now,
direct me to where it is? If it's
yes,
public?
I will keep that in the chat. See, and all this testing. All right, we'll see how this goes. So I'm going to put it in the chat, Shelley, if you could please display it. And then I'll probably keep doing the same thing. If it doesn't show up on my screen, then we'll just have you display it.
Yeah.
And I won't go into this one too much, but I just wanted, I know we've mentioned this before on some calls, but we have this heat-related surveillance dashboard. And this is a public dashboard down to the county level, which is really unusual. It is used by the White House, it's used by the CDC, and it's used because the national discussion around heat has really grown in the last couple of years. And as we all know, like, not only heat issues are increasing, but Arizona had a banner year in the Central Valley and I think southern areas last year. Okay, and then let me show you. So you're looking at this and you're saying, okay, they're tracking heat-related illnesses, good. And then I'm gonna see if this works. Actually, you're presenting now, so I'll just let me see.
I can stop.
Yeah, let me see if I can. Maybe it's other web pages that are a problem. I don't know. Can you guys see this?
Yeah.
Yay. Okay. So on the same page where you can find that dashboard, which is under NEMSIS reports, public reports, there's a document that's like a companion guide. And I'm not expecting you guys to read through this, and we're not going to read through this. But this is a detailed explanation of how NEMSIS is using our data and all the other states' data to find heat cases. So by finding them, we have to have what's called a population or a criteria, depends on what you want to call it. But basically, we're saying, what do we call a heat illness? And we don't follow this exactly, but I just want to highlight something here before we move on. So they're saying patients where the primary symptom or one of the associated symptoms, so that's one where you can put multiple ones in, or primary impression, or a secondary impression. And once again, you can have more than one secondary impression. Is one of these. And I realize this looks like a lot, but like, for example, T67.0, T67 is effects of heat and light. T67.0 is heat stroke and sunstroke. So any of these would be captured by them if it's in these fields. And these are national fields. We'll talk about this later. The data does get sent to them. And there's some other things down here, but I just wanted to kind of point out that they're looking for heat-related patients here. So if they don't get the data because it's being recorded in a field that they don't get, or they get the data maybe another field, like, I don't know, cause of injury, I don't think is one of the ones they're looking at, but not one of these, they're going to miss those heat cases and they're not going to show up on that national dashboard. And because for the most part, you want to make sure that your data standard matches what someone else is showing. If someone has gone and done a case definition, so occasionally we modify it, but generally we're going to follow the national standard, right? So, we are using that same definition, looking for one of those ICD-10 codes that refer to those descriptions of heat. And
displaying
I'm not
something.
No, I'll take it off just so we don't. So if you are going into your ePCR and your crews are recording it anywhere else, that is fine. You can record it wherever you want, but just please also make sure, and we're going to talk about pick list suggestions in a minute also, but please make sure that you have choices available on your pick list for the impressions and the symptoms for heat-related illness, and that you kind of look out for and start making sure that that is properly documented. Like I said, if you have a custom question or if you're documenting it in complaint, that's fine. But it also has to be documented in one of these places or we will not catch it. We are also doing an Arizona dashboard, which is internal, but it's it goes to the governor and the governor's office reviews it. And that's going to be broken down even more. That's more, you know, county, and I don't even know if it might go down to the city level. And it's meant to drive decision-making, surveillance. I know one of the discussions was about cooling centers. So this is really important data. And it's not just important a year from now, it's important right now. So the timeliness is a piece, of course, but if we're not getting it in the spot that we are looking for the population, you know, we get 1.3 million records a year. So we really need to follow something that we can pick out what's going on easily. Make sure that you are recording it in those areas, please, because we really have some weird numbers coming up. Mostly they look good. But when we start looking at this data, and that's why I put it under this topic of less frequently analyzed, usually that's when you find the strange things, right? When you really start digging in. So we're working with a few agencies now, but I would just really like to highlight, please go in and take a look and make sure you have these options available to your crews, that your crews know to at least select it as a secondary impression if it's heat related. Obviously, if the person has had a cardiac arrest, perhaps due to heat, that is a very legitimate primary impression, cardiac arrest. But please make sure that then they do capture the secondary impression somewhere in there as heat, because we want to collect these. It's important for funding for everyone. It's important for so many things. You know, we're trying to look at what sort of populations are affected. And that goes back again to recording. I know some of the demographic information is not very popular. A lot of agencies don't want to record race, ethnicity. But guess what we look at? We look at socioeconomic determinants. We look at seeing what populations and groups are being most affected, because we need to target public health. We need to help those populations in Arizona. So please look at that. The same thing is drownings and near drownings. We've been looking at that data, and we're hoping to dig into it a little bit more. The person who led our drowning program had retired, so we're still kind of sorting out where that's going to live and how we're going to do it. But we still look at drownings as far as from our data. It's the same kind of thing. It can be collected in the impressions. There's several codes that are drowning or near drowning codes. And also cause of injury. There are drowning and near drowning codes. And please just make sure that those are available to your crews, and that if it is a drowning or a near drowning, that those are collected. You know, we can't just look at, I think I tried to pull some data based on waterways, like the location, but sometimes people fall and hit their heads next to the pool, and that's not a drowning. And then also I've noticed, like, sometimes when the location is given for the drownings, it's legitimate to say single family home, but for a drowning, I think they're really looking for things like, is it a swimming pool? Is it a lake? Is it a river? Those kind of things. So if you haven't looked at that information, please do take a look and make sure that those are available. And that leads me into C. So defined lists, and I'm still working on this for mine because it takes a while to go through and reconcile everything. So I'm going to show you where these are, and I'm going to drag it over. So EMSRUG has what's called a defined list, which sounds a lot about a suggested list, but they're two different things. The defined list, I'm going to present this on the screen, were originally developed, I believe, to allow vendors, if they chose to, and if they didn't already have some, to do some kind of roll up. You know, there's an example here I can show you. Can you see this web page?
Sure. Yeah.
Yay. Okay. So if you were to go look at the defined list and want to find them, they're super, super easy to find. Let's see. So you'd go to technical resources on the EMSRUG. So EMSRUG.org, technical resources, defined list, and you're going to find them here. And they have suggested and defined. The main ones, are most of these, but I'd like to talk about are the symptoms, impressions, and cause of injury, and location type is good too. So I think this is one of the ones with a good example. So all a white paper is basically a walkthrough of what this is and how you use it and the purpose of it. And an example of a roll-up that vendors may or may not do is there's like a parent thing, cardiovascular, and then they're saying, here are the different, these are actually codes on the back end, right? They're just descriptions here of if your crew went in and said, okay, I want cardiovascular, and then this would expand. You don't have, if your vendor doesn't do that or they already do it, it doesn't really matter for the conversation we're having right now. But I just wanted to kind of point out why these defined lists are here. But if you go into impression, and you can download it in a lot of different formats. I usually use CSV, but or not. Maybe it's taking a minute. There we go. You're going to be able to pull this up. And if you guys update your own pick lists, then, and I'll expand this because I have a feeling you guys probably can't see this very well. If you guys do your own pick lists and you can adjust them yourselves in your system, then this is something, you know, that you guys could do. If you need your vendor to do it, then I would contact your vendor and just tell them, I want to make sure that I have all of the defined list data values available on my list or something similar. And so it will tell you here, you don't have to worry about the category as much, but these are the individual values that basically they're suggesting that you have available. And I had a couple that I found I didn't have, which, you know, happens. But so take a look through here. Here's the, oh good, that's what I was looking for. I'm like, where's the code? This is the code. This is what we actually get. If you called this, I don't know, if you relabeled something as broken toe, even though that's not, we're not going to get broken toe. We're going to get this code. So just be careful when you update your labels that they do represent this, because we'll never know what you actually called it or if you modified it. And that's with most of the data. But please make sure this is on here. For example, if you do, you will make sure that you have a heat one, I believe, and watch this not be the case, but I think I checked this. Oh, no, no drowning in that one, but we do have it on the cause of injury. And there is a drowning one in primary impression. So please go through and make sure you have these so that we can use all that data that you guys work so hard to collect to actually show what's going on and what your crews are dealing with in real time. Okay. There's that. So before I move on to the next part, which is we're going to talk a little bit about interfacility data. I just want to highlight a few items that with 3.5 we want to make sure y'all are collecting. Sometimes it can relate to 911 data, but this is mostly the focus for interfacility and medical transports. Does anybody have any questions before I go into that, or comments? Or Shelley, is there anything in the chat that's...
I don't see any hands raised, and I don't see any questions in the chat.
Okay. Make sure I don't accidentally close the meeting when I do this. All right, let me pull up something else. We've done that before where I can exit out of the meeting. I know other people have too. So. All right, I'm going to show you the next part, and then pulling something up, and this is the NEMSIS data dictionary. So I guess I could show you really quick. Once again, I have NEMSIS bookmarked. I'm not saying you have to have NEMSIS bookmarked, but it makes it easier. Doing under technical resources, that's pretty much where everything I feel like is, except for the reports and data dictionaries and XSDs. And then the easiest one to look at is, here's 3.5. You want EMS data elements. And I like the web one because it's easier for me to pick through. If you want something that's a PDF, I mean, not that you'd ever want to print it because it's humongous. There's a PDF version too. So I wanted to talk about a few data elements, and I'm going to show them on the screen, and there'll be links I'll provide to Shelley that you can put in the minutes. One of them is incident facility code, which is EC 10, and one of them is incident facility or location name. So they're related because it's the code and the name. And see, I'll go here. So I'll start with the code, but there's the name. So think of them together, kind of. Your crews are not going to see the code, but it's part of
this. Make it bigger. Yeah.
Oh, yes. Thank you.
The trip. Yeah. Yeah. That's what I was thinking.
Can you see it better?
Yes, ma'am.
Yay. Okay. So I just want to go over what this is for. So it is that facility ID number, at least in our state, it's going to be. You guys, I think everyone on this call delivers to destinations of some kind or another, whether it be through 911 or in a facility. You have to say where you took that patient, and your crews are picking a name. But on the back end, we're getting the name, but we're also getting the code. And the code is key because that's actually the only way our system really knows who should be able to see what data as far as facilities, among other things. And it's also a really good way to track what's coming and going. And it's really hard to do it any other way. We've tried. So for instances where you pick up at a facility, and I mean, you could use this for 911 calls if you pick up at a nursing home or that sort of thing, but you could use it for medical transports when you pick up someplace. But the key thing that we're really looking for is to make sure to use this for interfacility transports between hospitals. I'd love it for everything else, but that's probably the one that I want to highlight. So this means any facility you pick up from, there should be a code on the list. If there's not, I can add it. There's also some generic codes which we can use in the interim. But we'd like you to document where you picked up the patient from. And like I said, this is the code. Let me see if I have any more notes I wanted to mention. And generally, this is going to be populated. I mean, I can't speak for all vendors, but this is what NEMSA says. It may be populated from the list that y'all have created in your own systems, the D Facility 03, that already populates your ePCRs. You're not going to have to go start a whole new list. You shouldn't have to. It should all be able to come off of that list. And then let me go back to the name, as these work together. This is the only part your crews will see. It is also generally created from a list, so you shouldn't have to, you know, if you're adding facilities for drop off and pick up on your own, you should be able to use that same list. You probably, a lot of cases, to be honest, are documenting this somewhere anyway. But we're not seeing as much of it come across as we'd like when we start looking at interfacility transports. It also will be helpful down the road with hopefully allowing data for the endpoint receiving hospital and the hospital that gets picked up from to be able to see some of the information. So this is the name of it. Once again, I mean, I'd love if you use the name that we use officially, but if you want to use your own name, like if you're still calling something Banner Good Sam, even though it's not called Banner Good Sam anymore, I can live with that, but the code has to be the correct one. So these elements need to be on your ePCR, and you need to fill them in. You need to make sure that your vendor is sending them. And when it says optional, all that means is NEMSIS doesn't get it, and they don't have an opinion on whether or not states should require it. But it's still available in the NEMSIS data set. So every single vendor should have these elements available. This shouldn't be something you have to pay your vendor to add a custom element or anything like that. But do make sure that they are, I'm going to try to communicate with the vendors too, but do make sure that you request that your vendors have this added to your XML export if they haven't already. Okay, and then one other thing I'm just going to put, I'm going to pull it up on this side and then I'm going to put it, oh no, it's just going to download it. I'm going to show you guys where it is. So I was talking about the facilities list. It's just a good thing to know where it is anyway. So if you know how to get to the Bureau's webpage, I know I go over this, so most people probably know exactly where this is, but if you don't, I feel like this is It's my page, so I feel like it's a good page. Data quality assurance, AZ-PIERS. And then within here, we have a ton of different resources. And this one, reporting and system resources, these little tabs are kind of hard to see that they're tabs, but they're just such light gray. We have several lists that get updated frequently, and I send out an email. Validation rules and change logs, which I'm not going to open. EMS agency list, which is when you're transferring to another agency, we have that required data element. We have to say who you got the patient from or who you gave them to. This gives you all the codes and agencies that I have in our system. But here is the facilities list, and it's just recently been updated. So if you click on it, it will automatically download. I don't know if you have a block on downloads, you'll have to probably check with your IT, but and then you can enable editing so you can save it if you really want to. And we have a change log on here too from the last time, but it goes through. And so if you're picking up at a certain location, we'll do Flagstaff Medical Center just because I hit on it. So Flagstaff Medical Center, if you call it FMC, I can live with that in the scene.13, but this is the code you would use. And that's, you know, if you're picking up there and you're taking them, I don't know, to Phoenix Children's, then you just, you know, you need to have both of those. The pickup location you guys collect really well because we've had that for a long time. But I feel like the drop-off location, the destination. But I feel like the pickup location is something that is kind of a gap. So if it's not on this list, please let me know and I will add it. All right. And then I have one more element I wanted to highlight. This is a new element in 3.5, but everybody should have it. This is actually one that EMSRUG does get. So hopefully it's something that if you have it on your run sheet, it automatically would be in your export. It should be, but it might not be. So let me go to can you still see this at a decent size, Shelley?
Looks pretty good. Like we're tracking.
Okay. Oh, and I think there might be a question, so I hear something. I don't know if not.
I think Josie. She says she didn't mean to raise her hand.
Oh, okay. I'm so excited. Okay. So the next one is the last one that we're going to highlight is, and this one really is meant for medical transports and interfacility. That's how it's defined. So it wouldn't be for 911. I mean, I guess you could, but I don't know why. I don't know how it would apply unless you're doing medical transports as an agency, I guess. So it's eSituation 20. Okay. And like I said, this is new in 3.5. It's a national one, meaning that EMSRUG does get this and they track it. And it's just general categories of the reason for an interfacility transfer or a medical transport. And I know they're calling it interfacility transfer, and then the type of service requested is now actually divided into things that aren't just interfacility transfer. They actually divided interfacility transfer into like several different subcategories. But you guys all know what an interfacility transfer is and what a medical transfer is. So basically between two facilities of some kind, and not a 911 situation. So these are general categories. There are a couple that are kind of other. It's meant to support a text field, which we do not require. You're welcome to use it. But it's the justification for transfer and counter. So there is a text field that this kind of goes along with, but we're really, from our perspective, we're interested in the data that is, we can categorize. And just to allow, if it's a cardiac specialty, if it's a drug rehab, if it's psychiatric behavioral care, I'm sure there's a lot of those. Pediatric, this will be really, really useful. And it's something that is new. So I feel like we haven't had a lot of people realize that they need to add it to their 3.5 form. And like I said, make sure that you're filling it out and make sure that it's being sent over. We really appreciate that as we look at trends. We could use this during COVID a little bit. So now, because this is a newer element, there's always a possibility that you're going to be like, there's something that needs to be on here that's not. We absolutely have the opportunity to recommend additional values be added. So if you think of one and it's not on here, let me know. I feel like I should tell all of you with PTSD from 3.5 to plug your ears. The 3.5.1 is coming out probably with an implementation date of late 2025. And it's a small change. That's why it's 3.5.1. But I believe there are some new values already slated. I don't know what they are to go into this list, but I can still get it on the books for the time after that. So please let me know if there's anything on this list you feel is missing and that you're trying to document and there's nothing that fits. Okay, so that is item 4. And then I'm trying to make sure we have enough. I think I'm going fast enough. I think we will have enough time for everything. I'm sorry, I'm going too fast. But does anybody have any questions before I move on to item 5? No, okay. This next one is probably a little boring, but it comes up so much in conversation that I feel like it's a really important thing for us to highlight. And I know NEMSIS also said they get the same kind of confusion and questions from people. So let me get out. Well, yeah, let me get out of here. I may have to go back in there, but okay. So first, I guess I'm just going right back to this anyway. There's a difference between a NEMSIS element when we use that terminology versus a national element. And this is probably just lingo that has come about over the years when we're dealing with data and NEMSIS data and EMS data. So I can totally see why this is confusing. Because NEMSIS is a national organization, right? So why would they be different? A NEMSIS data element, when we use that terminology, we're talking about any data element that's listed anywhere in the NEMSIS data dictionary. So let's see, something random. We don't require really the e-payment fields, but if we wanted to, we would say this is a NEMSIS data element. We wanted to collect insurance company name at the state level if we were telling agencies they need to collect that. This is a NEMSIS, or this is a NEMSIS data element. See, now I'm getting myself confused. It starts with an E, there's demographic ones that start with D, but it's not a custom element. So there is actually that dictionary for custom elements. In Arizona, we require some like for opiate overdoses and things like that. Usually just because our vendors built it, it starts with the letters IT. Doesn't necessarily have to, but it's not going to be in this NEMSIS data dictionary. So by being a NEMSIS element, theoretically, all vendors should be able to have these available. They're not custom work, they're not dev. I have had agencies or vendors sometimes that haven't actually created certain ones, but that's not an expected outcome. Like these should be available. They're designated by NEMSIS. So they should be easier to use and have available to your crew and to be able to send different places. Then when we're about national elements, I have a PDF I wanted to show, but first I think I'll show here. Do you notice how like there's nothing on this page, right? But if we were going to go to, here's all the ones for e-response, for example. Let me pick one that we don't collect, but you guys may collect this, but a lot require beginning odometer readings. It's recommended that the state collect it. That's why this little thing is here. But if it has this, that means NEMSIS also gets it. So anything that doesn't have, I'll just go back to this main screen and I'll show you another list also. Anything that has a little means that we do send this data, if it's available, onto NEMSIS. And they're using it in their national cubes at an aggregate level. And, for all their analysis that they do, that they provide maybe to the White House and the CDC and the NIH and those sort of things. And they partner with a lot of other areas. They don't get anything that doesn't have an N. So when you hear me talk about it's not a national element or it is, NEMSIS is Sometimes that comes into play because we want to provide EMSRUG with the data that they need to do their kind of work, like those dashboards that you saw. And if we're getting something in a field that only we get and they don't get it, we're not going to come up with the same answer when we get asked a question. The data is going to look contradictory, which even though it's understandable, it would be contradictory. People who see data in general are going to see that as meaning that the data is flawed, even when it's not. And we also have a data agreement, so we generally do try to give EMSRUG what they need in most cases. Let me pull up. There is a data dictionary that only lists national elements, but I just want to show you one more thing before we move on. This is also on the EMSRUG webpage. I'm going to include all these links for Shelley in case, you know, in the minutes, so you guys can pull them up if you're interested. This is a list that EMSRUG provided. This one is 3.5, yeah. And it just lists the national elements.
Can you zoom in a little bit?
Oh, yeah,
please?
sorry. I feel like I need like that repeated to me over and over. Let's see.
It's tiny on my screen.
Mm-hmm.
Perfect. Thank you.
Sure. So, and I can put it in the chat too. So I do get the question from time to time, well, what are you giving EMSRUG? What are they, you know, sometimes agencies are like, I want to know what's being sent. I want to know who's getting what information. This would be what EMSRUG gets. They don't, if it's not on this list, they do not get it. And that doesn't mean that you know, there's a bunch of stuff we collect, like complaint is a good thing. We don't use it at the state because it's a text field. EMSRUG doesn't get it, but the hospitals use it, and they're also another end consumer of data. And so we try to kind of consider when we have a fairly short required list compared to most states, but we try to meet the needs of the people who use the data, because that's really the whole point. We have, you know, cardiac registries and trauma registries, and, you know, those designated centers, they need that data sometimes for their licensing. And your data is super important to them. It would not function properly without it. And then also, like I said, the EDs want to see things, or the medical direction at the hospitals want to see things and for refusals, or signature date times and who was signing and that kind of stuff, that we're not going to use a signature graphic. I don't even think we have it listed as required, but your hospitals a lot of times want to see something like that. Keep that in mind when something doesn't make sense, or when we're telling you to fill something in, like the primary impression or the secondary impression, and you're like, I'm already filling it out in chief complaint. What difference does it make? Those fields are required because certain people find them really important, but they don't meet the need of every user. Okay.
Hey, Anne, can you put the link to that in the chat, and then I'll capture it for the minutes as well.
Sure. See, gotta find her meeting. There we go.
Super.
And all of this is also, not that you guys want to go hunting it down necessarily, but all this is also available on the EMSRUG website, or our website, depending on what I showed you. But okay. So that is the end of what is the difference between an EMSRUG element and a national element. So that hopefully now when we use these terms seemingly interchangeable in conversations as we talk about things in public meetings and stuff, that it won't throw you. Like, you'll get exactly what we're talking about, and you can explain it to others. Is there any questions on this at all, or anything as we go along that you are thinking would have been really helpful for me to show you that I can either find or develop? Or okay, moving along. And I want to leave as much time as we can, and hopefully we don't go over. So number 6 is super short. For those of you that have asked for facilities to be added, usually the ones that are most highlighted as far as an issue for this are hospitals. A new hospital opens or gets bought out and gets a new license, and their number that we have to have, that facility ID, it's a licensing ID, isn't available until they've been inspected, which as far as I have noticed, generally they get inspected and then like they'll open the next day for patients. But with our process, I can add it to our system that quickly, but then it's got to get added to the schematron, which has to be developed. It's to be sent to NEMSIS. If NEMSIS approves it, posts it. We have to do, change logs. We post it to our website. Our vendor has to apply it to our website. I send it to all the vendors and the agencies who then need to apply it to theirs. So there's a process. And between that and the fact that we don't do schematron updates, I'm not going to do one week and then do it the next because it's a big burden on some of the vendors. So we basically try to do about once a month. But that's caused a lot of stress, which seems ridiculous. I mean, the stress is not ridiculous. The fact that this process is so slow seems ridiculous. And that we can't find a better way to do it to not delay agencies being able to record what they're actually taking their patients to, which is the whole point. I worked with the licensing team, with our informatics supervisor, Joseph, and I was granted access to like an area where they list facilities that are seeking licenses. So before they actually get licensed, they have to put in an application and go through the whole process. Makes sense. And so during that time, I'm just going to check that spreadsheet occasionally and start adding locations, especially if they're hospitals, as soon as they're in there, so that it can be available and we can add it to our schematron. If not before, then very, very close to when they actually open. The caveat for this is, and I'll put it on some documents, but this is hopefully obvious. This is not, so if we add, I don't know, Morgantown Hospital to our facilities list, and it's not yet open, it's not yet officially licensed, but I put it in there because I have the facility ID available as like a precursor, and I send it out to everybody, and it's on the change log. That does not apply to imply that they are licensed at this time or ready to take patients. It's just a way for us to hopefully improve this process. So just because it's on our list doesn't mean that we are endorsing them as being licensed. I just really felt like this has caused so many problems over the years, and I hope that this workaround works. So we'll see how it goes forward, but I appreciate everyone's feedback that helped me move this change along between our two different bureaus and departments, and hopefully it'll make it easier for you all. So, okay.
And can you guide me to where the facility lists are on your QA page?
Yep. So go under reporting and system resources. Yep. And then there's a facilities, and then there's an agency. So that one, when you click it, it automatically downloads in Excel.
Got it. All right. I'm going to just copy and paste.
Yeah, and if I could paste the link in, yeah, that's good. And then they'll have to go to that tab and then to that thing. Hyperlinks that are still embedded in the words do not paste as links into the chat in this program. So that's why I don't think there's a way to do it.
Oh, sorry, I double did it.
Fine, now that's twice. So, all right. I know we only have 10 minutes left, but we might go over. Okay, so HB 2609, CON holder info. So we'll go over this in a second, but we talked about this a little bit at the beginning of the meeting. If you're a CON holder, you'll need to be uploading these reports. Can you show where the slides are? And we can put these links in the chat too. And I don't know if we have anybody on the call that's going to go over them, or otherwise we'll show where they are and make sure everybody has these links. Please, 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 if you are a CON holder, you have no idea what we're talking about, or you haven't done this yet, do not delay. Take a look at these today. I didn't mean to.
So this is the EMS homepage. You're going to go to ambulance programs, then the ground ambulance program, and that has a subheader for 2024 regulatory changes and HB 2609 resources. And this is the checklist.
That's a checklist. So that's super good. Take a look at that. Really important. And then how to upload it. So once you actually get your items, your reports, you're going to need to be able to upload it into the portal. Make sure that you try that out. In case for some reason you think you have the correct permissions to do this and you find out you don't. It's happened because it's based on, I think, and this is not my system. I don't know if Lydia's on. Okay, Lydia, thank you. Lydia is the one who administers the licensing database.
Do we have time so I can just go real quick into the website and show the steps?
Yeah.
All right. So, Shell, I'm gonna share my screen real quick.
Sounds good.
Oh, can you guys see that? Okay, here goes. Can everyone see that?
Yes.
Okay. So there's 3 reports that you're required to submit to us by July 1st. It's going to be your ARCR, your CON compliance report, and the urbanicity report. So once you have those reports ready to submit to the LMS, you go into your license management system, you log into the system. If you're having someone else that doesn't have the required role to submit the role, make sure you reach out to someone from the CON team so they can assign the required role. They're gonna know if they have the provider tab. If they have the provider tab, then most likely they'll have access to the provider applications. If they don't have this tab, then that means they need access to it. And we are the only ones internally that can assign those roles. But once you're in here, if you have more than one role, you're going to see a list of providers. Then you go to select the one. You click on applications. View applications for that provider, and then you're going to see all the applications that we have available to the providers. You're going to scroll down until you find the application to submit the reports, and then you just have to click apply. And then it's going to take you to the application. And then on the first page, the information should auto-populate. You save and continue. And then it's going to take you to all the other tabs. In order to move to the other tabs, you have to save first. So we have the annual ARCR documentation where you can upload it in here. If you need to upload more than one document, you can do that by clicking on add another one. Let's see if it's going to let me. Yeah, it's going to let me save and continue. Again, we have a section just for the CON, the annual CON compliance report. There's some information, and then we also have the rule reference along with all the other applications. Save and continue. Once you have your House Bill 2609 urbanicity report, there's also a page, and then you save and continue. Whenever you see a red asterisk, that means that's a required field. So the system won't let you submit the application unless you have everything filled out. The last page, we have the acknowledgements. You have to click through those, and then you sign it, date it, and then submit. If for some reason you're working on the application, but you have to log out of the system and have to come back, the application is going to be under continue. Under the continue section, you're going to see it here, and then you can just click continue, and it'll take you right through to the application. And then let's see. You're going to see here that I'm going to try to submit the application. Quick. And it won't let me, so because I didn't fill out the required information. So you can just click on the link, and it's going to tell you like where to go, where that information is missing. And once you upload it, you save it and continue. And once you have everything, you can submit the application. Any questions? And then again, if you go to the ADHS website, the information should be here related to all the requirements, the checklist, I'll walk you step by step related to everything that's needed to submit. What's not uploaded, you should upload, but it'll take you in here. So everything that you need is here. And if you have any questions related to AZ-PIERS, you can contact Anne. Or for all the other reports, you can contact Karen or Michael. And that's that. Many questions? Vince?
So later on this year, when I do submit my actual ARCR, do I have to fill in the exact same form that we're looking at right now, the application for the ARCR, the CON compliance reporting, and the HB 2609, or is it going to be different?
It's going to be the same.
So that being said, so we'll just have to submit the same HB 2609 summary report, or are we going to have it where we can go to your site and actually, I guess, mirror the ARCR time period? Is that what you're looking at?
Yeah.
Okay. Because I know that, right now when you go there, you can't really select the date. It just spits out, or excuse me, that's a terrible word. It just creates a report, and it is independent of any times that we put in. But the one coming up later this fall, will we have that ability to go in and take a look at the time range and pick it? That is according to our ARCR.
For the urbanicity report?
For the HB 2609 report, because, it sounds like we're going to have to submit something, right?
Yeah, Vince, I mean, I don't know about the timing and stuff, but yeah, there'll be a second report available eventually that will allow you to do fiscal year if you want to do fiscal year. The reason it's not there yet is we don't have any of our 2024 data urbanicitized. I don't know, I made up a word, but the urbanicity is not attached yet to any of the 2024 data. So if we put it out there right now and you ran it, all your 2024 data would come up as blank for the urbanicity part. So, but it will be available.
Right. And so the other question is on the 2023 annual CON compliance report, right? Those language that is very specific to each agency CON. There really isn't a definition per se that says there's what actual time period it should be. But historically, it's always been the most recent report prior to submission of your CON, where you have 12 months of data. Is that going to be the time period that you're pushing, or do you have something more specific?
I don't know, Lee, if I know Karen's on the line, or Rachel may know the answer to that question, or Noreen. I do not. All right, do any from our regulatory side of staff?
Hi, Anne. This is Karen. The CON compliance report is going to mirror the ARCR term, that 12 months. Everything is going to mirror either a fiscal year or a calendar year. It does say, 12 months, but we are specifically, it is when you, I believe when you go into statute, Rachel probably has it quicker than I do, but it says it's aligned with your ARCR submission, the time period.
And those are the questions I have. I'll just look forward to more information as it comes along. Thank you.
Thank you, Vince, for the questions. It also helps us kind of know what people are wondering. If you're wondering it, other people are probably wondering it too. So we can make sure that those kind of questions get answered in our FAQs. Looks like Brittany, you have a question from Queen Creek. Brittany, do you want to unmute? Do you have a question?
Yes, sorry, I forgot to unmute. I apologize. I had a quick question. For the next round that we do, the HB 2609, is it going to be possible for us to kind of have more criteria to be able to see exactly like what the data is being, like what how you guys are creating the report in the HB. So we were basically trying to mirror it so that we could then see where our outliers were, where problems were. And with right now, how you go in the system and you select your agency, you can't really see exactly how that report or what it's pulling. Is that going to be available the next go around so that, again, we can see exactly, basically mirror the exact report you guys are creating in our system to then pull and see what's going haywire? Because right now we see these results and we know roughly what you're capturing, but we can't see exactly what data set values and how your report is created.
I think if you go in and save as, because there is the option to save as, I think if you go into report editor and open that report and save as, I believe you'll have access to all of the tabs and you'll be able to see the criteria.
Okay.
Now, if you put your system, you're not going to have any of the urbanicities.
Okay.
That's what we're doing in our system, but you certainly will be able to see what population is being pulled. And then I can also run something on my side. I need to make it available to everyone, I think, but just where you can pull all this, well, limited columns because you can only have so many before it decides it won't run, but all the detailed information on the runs that are included if you do want to take a look at, you know, the ones that kind of seem odd. So I can do that too. It's not the same report, but it's the same population.
Yeah, that might be helpful for next time because we're just trying to identify exactly how we got to those results because a lot of times there's discrepancies between what our system's showing is yours. So we're trying to mirror between the two to say, hey, what's different? And then how do we approach whatever the discrepancy is and determine what, you know, what to the extent needs to be done, if anything.
Right. Yeah, no, if you would just even want to go in though, and right now or later to the report and save as, you'll be able to see exactly what it is. And I don't know if you can export that report. I don't know if you have the ability to do that, but I can do that for you too. And you can try to import it into your system.
Okay. Thank you.
Yeah, sure. And then looks like Ray Proa, you have your hand up?
Yeah, hey, thanks, Ann. Quick question. Just because it came up and I happened to see it, we turned ours in May, and it shows pending. Or just so I can tell my administration, because they were asking if we had it done, if it was all complete, and if we've been approved. Like as far as that report, are you going to start like processing them after July 1st or before then? Just so I can kind of give them an answer.
I think that question is also for Karen or Rachel as to once all the reports are posted into the EMS portal, I guess it's still saying pending and they just want to know when those will be processed so they can see that they've been approved or whatnot.
Hi guys, I'm not hearing anyone else chime in, so we will definitely start going through the system on our side. And if there are any statuses that we need to change, Ray, we will be updating those as we move through the process. If you submit it on your side and have confirmation that everything went through, you should be good to go, but we will be reviewing and cleaning up on our side in case anything appears to be pending, Ray.
Perfect. Awesome. Thank you, Rachel. Appreciate it.
Okay, do we have any more questions related to any of the parts we've discussed so far?
Hey, Ann, this is Mike Gracci. Hey, Raymond, I'm relatively new here, so I don't know what district or what company you're from. I'd like to look that up just to make sure you're all in the system.
Absolutely. Yeah. It's we're CON number 82, Fort Mojave Mesa Fire Department.
Okay. And I'm sorry, you said number 82?
Yeah, CON 82.
Okay. Thank you so much, Raymond.
Of course.
Thanks, Ann.
And this is Rachel one more time. I just wanted to chime back in and echo, I heard you say it, but again, we really appreciate getting your questions and your feedback on this round. I know we don't have time today to go through as many individual questions as there might be for some of the certificate holders, but this is very valuable to us. We really appreciate everyone taking the time to go through these steps. And I'm sure we'll be following up with some of you all offline to hear if if there's anything that we can work on improving as we go through this process together. The submissions that have come through so far are good. We hear that the checklist is a helpful resource. And if there's anything we can add to the checklist to make it easier on folks as we go through this process, please let us know. You guys have been wonderful to work with. Thank you very much for going through this process with us.
Thanks, Rachel. Okay. Did we cover item 7B yet? At least I'm going to show where that is if we haven't.
All right.
Shelley, can you, or
You want to?
Lihia, can you unshare? Oh, okay, thanks, Shelley. And then can you pull up the, I just want to show everybody where it is so they can go take a look at it.
Sure. There's a link in the agenda. And then if you want to walk through a different way, if you go to our Bureau website, it's under ambulance programs. And the ground ambulance program has some subheaders. One of them is called 2024 regulatory changes and HB 2609 resources. So it's there as well. But yeah.
Okay, so if you look through the slides, I believe it's still, what does it say on here?
Slide 35 through 40 show the steps.
So basically this kind of has some steps, and there's also below this, there's some FAQs that are answered. You don't have to look through the full slide presentation. That's why we put that. I mean, you can, it's very informative, but that's why we put the slides there so that, you know, hopefully people didn't pull it up and went, I don't have time to look at that many slides. I mean, take a look at that part, and that should help with some additional questions on how to do some of the requirements. And the report's due by July 1st, which is Monday. So
It looks like we're over time. I don't know if people need to drop off, they can, or we can keep going through the agenda if you like.
I was going to keep going, but if people need to drop off, the next items aren't, I think, they're just kind of some reminders. And we should be able to finish in the next couple minutes, I don't think, unless people have a lot of questions at the end, I guess. So the only other thing I kind of wanted to cover, and if you've been on the meetings before, you already kind of know this, but I want to make sure that the non-CON holders also realize that this is something we're looking for them to do. So we're asking for everyone to go into their licensing portal, the EMS portal, and update their rosters for their agencies to make sure that they have an updated roster. So not people on there that don't work for you, have everyone on there that does. We'll have some additional kind of features and instructions coming soon so that you can add personnel potentially that aren't EMCTs, because the plan is to have the rosters on the licensing side create and inform the user lists on the AZ-PIERS side. And every time you take someone off your roster or add someone, it should sync up to Elite. If you add someone, there'll still be like one little step you have to go in and give them what level of access. It'll default to a provider level. But the removal part is key too, because if you remove someone, it should inactivate them for your agency access in AZ-PIERS. And because I believe that agencies that don't have CONs are not going to have what we call an organization coordinator, which is the person that actually will have the ability to go in and change the rosters. If you don't have one of those, I think that's mostly CON holders. I have a Google form I put together that I plan on sending out soon that will allow you to kind of sign someone up to be an org coordinator in your agency and licensing. So you can go in and update your roster, and you can have more than one. And we're kind of going through that process. And then there is a slide presentation on how to go in and update your roster. So if you are a CON provider and you already have an org coordinator, You should be able to follow that. If you're a CON provider and you go in and you can't figure it out because you're not an org coordinator, then you contact your regional coordinator, the person that does your ambulance inspections here at ADHS, and they should be able to add you as an org coordinator. So you can do that. And so that's it for that part. I just want to make sure everyone's working on that because we're starting to sync agencies over gradually. We've done one. We're kind of checking it, and we're going to start doing more. And so I'm going to start emailing and checking and see if you guys have updated your rosters. And then eventually we're just going to do it. And so I will give plenty of warnings and communications, but that would mean that everybody's just got to kind of note the communications and kind of make sure that they are meeting what we're going to need, so we don't cause a bunch of chaos when we sync everything up. Okay, and then lastly, we have open forum. I do want to mention just real quick in case people start hopping off that our next EMSRUG meeting is currently scheduled for September 5th at 10 a.m. And do we have any questions or requests or anything for next meeting? Or you can email me, and I kind of keep a running list and see what we can fit in. Okay, there are no other questions. Then we will finish for the day. Thank you, everybody.
Thank you, everybody.
Thanks, everyone.